causes of chronic kidney disease, some tests used to measure kidney function and look for or diagnose chronic kidney disease, and symptoms of chronic kidney disease. Then we'll spend some time understanding things that you can do to help keep your kidneys healthy, prevent kidney disease, and slow the progression of chronic kidney disease. And since I'm going to be saying those words a lot, there's a common abbreviation of CKD for chronic kidney disease, and I'll use that interchangeably. On our next slide, I want to show where the kidneys are located in the body and begin talking about what they do. So most of us are born with two kidneys. They're about the size of your fists. And if you make two fists and put them on your back at the bottom of your ribs on either side of your spine, that's about where your kidneys are. And these kidneys do a remarkable job maintaining our blood composition, the amount of blood that's circulating in our body and the chemical composition of that, regardless of what we eat and drink. And on the next slide, I'll show you what they look like on a more small level. So blood is delivered to the kidney through arteries, which then goes to the tiny functional units of the kidney, which are called the glomerulus, or glomeruli, because we have hundreds and thousands of them. In these glomeruli, the blood is filtered or cleaned, and filtered blood is returned to the body, returned to the bloodstream through a vein. And the other material, which is urine, which has been filtered out of the blood, is collected in little tubules where it's further modified, drains into the ureter, which leads to the bladder, where urine is stored until we go to the bathroom, we void and pass our urine and empty our bladder. The kidney really depends on getting a lot of blood flow every minute of every day to make this process work. And so kidney disease and kidney health is intimately tied up with heart or cardiac function and blood vessels. On the next slide, we went one too far, yeah. So the kidneys remove waste products at this level of the glomerulus. They're little functional units. And we typically talk about kidney function as the rate at which the kidneys are able to remove waste products or filter the blood. So historically, this has been called the creatinine clearance, creatinine being a naturally occurring substance in our bodies that the kidneys remove or filter. But more commonly, this has been called the GFR, or glomerular filtration rate, as substances are literally filtered from the blood by the kidney. Next slide, please. In addition to filtering substances into the urine that are going to become waste products, the kidneys also hold on to what belongs in your blood. So the kidneys keep other substances like protein and blood cells inside your blood and out of your urine. And I like to visualize the glomerulus like a little miniature colander that holds on to berries or whatever you're rinsing off and lets extra fluid, tiny bits of dirt, maybe little bugs pass through those tiny pores, but maintains what your body needs within the glomerulus. You can picture that if those little pores or holes got a lot bigger, the berries could slip out them. Or if for some reason the pressure in that glomerulus was really increased and you squashed down with your hand, you could squash components out of those little holes that belonged in the blood. So the glomerulus is like a little bitty filter. Next slide, please. The kidneys do a lot of other things too. They control how much fluid is in the body. So if you drink a lot of water or other beverages, you will make more of a dilute urine, whereas if you are drinking less on a certain day, you'll make less urine and it'll be more concentrated. The kidneys help regulate blood pressure, both by managing the fluid balance in your body, the sodium balance in your body, and through hormonal functions. The kidneys also regulate electrolytes like sodium and potassium and eliminate nutrients that you don't need because you have more than your body needs, in addition to eliminating waste products. And the kidneys also balance the pH, or acid-base levels in your body. In addition to this, on the next slide, I want to mention that the kidneys also produce hormones. In addition to the hormones that act on blood pressure, the kidneys make erythropoietin, which is the hormone that tells our bodies to make red blood cells and keep us from being anemic. The kidneys also convert vitamin D that we absorb through the sunshine or through food that we eat, and convert it to its active, or hormonal form, where it works on the body, maintaining levels of calcium and phosphorus and promoting healthy bones. So the kidney has functions that go far beyond just making urine. On the next slide, I'd like to talk about what chronic kidney disease is. So the functions that we just talked about are what the kidney should be doing and is doing when it's healthy, but the kidney can be damaged. So first, with chronic kidney disease, this is something that's been going on for time, at least 3 months. If you had a kidney problem that was diagnosed today, we wouldn't know if it was a brand new problem or a chronic or ongoing problem. So by definition, chronic kidney disease has been going on for at least 3 months. And then there's a pretty formal definition that I want to go through, because if you look up chronic kidney disease, this is what you're going to see. But in the most straightforward way, chronic kidney disease is a reduction in the body's ability to filter waste products, and specifically a reduction in the GFR, or glomerular filtration rate, to below 60, with or without other markers of kidney damage, or just having other markers of kidney damage. So the diagnosis of chronic kidney disease covers a variety of problems, but the most common marker of kidney damage is protein in the urine. And we'll talk about that a little bit more. That can be measured as proteinuria or albuminuria. Albumin is the #1 circulating protein in our bloodstream. Some people also have structural abnormalities of their kidneys that can be seen on imaging tests like a CAT scan or an ultrasound or an X-ray. And these can be changes in size, having kidneys that are much bigger or smaller than average, or kidneys that have cysts in them. One question that I'm often asked is, if I have one cyst in my kidney, is that a problem? And I'll say that having 1 or 2 cysts is something that becomes a lot more common as we get older, and it's not the same as having cystic kidney disease, which we'll talk about later. Some people need a kidney biopsy, and then we can see microscopic changes under the microscope that are not normal if somebody has kidney disease. And anybody who has a transplant, even if it's working really well, is vulnerable. And so this chronic kidney disease can also be a risk state because you have only one kidney, or because you have a transplanted kidney and you need to be paying extra attention to it to ensure its health and well-being. Let's go to the next slide, please, because I want to talk about how we know if we have chronic kidney disease. And this is really done through laboratory testing. The most common test that is done is for creatinine, which is a substance in your blood. It's a product of metabolism. We all make it and have it, but it can be used to measure kidney function. Less commonly is a blood substance called cystatin C. This is also produced by cells in our body, and we all have it, and can be used to assess kidney function. This is not used as commonly as creatinine is, but it can be useful for people who are significantly bigger or smaller, or who have certain other medical conditions that make creatinine less reliable. The second part of looking for kidney disease is doing a urine test to measure how much albumin or protein is in your urine. with that albumin or protein being a marker of kidney damage. Sometimes more elaborate blood tests or urine tests are needed, and sometimes people have ultrasounds or other tests, but by far the most useful and common and practical way to diagnose kidney disease is by measuring the creatinine in the body and looking for protein in the urine. On the next slide, we'll talk about how those numbers are used. So GFR is calculated using a formula from the blood test measuring creatinine. And most labs will give you your GFR as part of your laboratory report in addition to your creatinine and other blood chemistries or lab measurements that you've had done that day. The formula for measuring GFR includes age and sex and creatinine, and it gets plugged into a calculator. Historically, race was part of the calculation of GFR, and in 2021, the American Society of Nephrology and the National Kidney Foundation had a combined task force and recommended removing this aspect of the calculation and adjusting the formula. And this is something that most labs have done and that the American Kidney Fund supported completely. There's not one creatinine number that is normal for all people because this does vary with muscle mass and with age and with sex. But having a lower GFR is a way of measuring kidney damage or chronic kidney disease. On the next slide, we'll talk about stages of kidney disease. And again, this is pretty formal. And if you look up stages of kidney disease, or if you've been told you have a stage of kidney disease, this graph shows where you fit into that. I think that the most important takeaways from this slide are that the more reduced your GFR is, the more serious your kidney disease is. And similarly, the more albumin or protein you have in your urine, the more significant or severe this is. CKD can change with time because kidney disease can be progressive. And so it's possible to have stage 2 kidney disease and then years later have stage 3 kidney disease. In stage 1 and 2 kidney disease, the GFR is in the normal or near normal range, meaning the kidneys are actually still doing a good job removing waste products from the urine. And then in stage 3 kidney disease, the GFR is reduced from between 30 to 90. And so the kidneys are not working as well as they should be. In stage 4 kidney disease, the kidney function is reduced and the GFR is 15 to 29. And this is a more significant reduction in kidney disease. And in stage 5 kidney disease, the GFR is less than 15. This is the most severe stage. It shows that the kidney is working less than about 15% of normal. And I know I'm supposed to save my questions until the end, but I did see something pop up in the chat, which seems relevant right now. So I'm going to squeeze it in. And the question is, what does it mean if your GFR is occasionally, but not always, a little bit below 60? And because our blood tests can fluctuate a little bit with time without showing a real trend in one direction, like a creatinine changing with time, but just varying a little bit based on when you have it checked, like many lab tests do, that creatinine number, when it is plugged into the formula for GFR, can sometimes give you a number that is a little bit below 60 or a little bit above 60. And what I think is especially concerning is if your GFR is going consistently down with time, showing real progression of kidney disease. The other thing I want to say is that kidney function changes a little bit with age. And so as we get older, and I'm putting myself in this category, you don't have to be in the geriatric range for this to be true. Kidney function goes down a little bit with time and as we get older. And this doesn't usually cause symptoms unless there's another problem, but it's typical for people as they age to lose a little bit of kidney function. The other thing I want to say before we move to the next slide is that even though I've talked about a formula and a calculation for GFR, and that's true, it's still an estimate. And this formula isn't good enough to say your kidney function is absolutely precisely this number. We talk about it as a calculated number, but it's a calculated estimate. On the next slide, I want to highlight how common chronic kidney disease is. A lot of times people wonder, is this a common problem? Yeah, this is a really common problem. 37 million Americans have kidney disease, which is 1 in 7 people. But most people with CKD don't know that they have it. Only about 10% know, which means that 9 out of 10 people don't know that they have kidney disease. On the next slide, I want to talk about common causes of chronic kidney disease. The most common cause is diabetes. That's true in this country and worldwide. Next most common is high blood pressure and other blood vessel disease. These are the 2 most common, but there are lots of other common causes on the next slide that I want to highlight. Specifically autoimmune disease, which is both diseases like lupus, which can be a full body disease that impacts the kidneys, and autoimmune diseases that go by names of glomerular nephritis, which lead to inflammation of the glomeruli, the little units of the kidney themselves. Then there's kidney cyst disease, like autosomal dominant polycystic kidney disease, where the kidney tissue is replaced by so many cysts that the kidney doesn't have enough normal tissue to do its own job. That's a genetic disease, but there are other genetic causes of kidney disease that aren't as common, but add up to be a significant cause of kidney disease. Then there are environmental causes, usually from work that we do or hobbies that we have. And certain medications can cause kidney disease, both prescription medications and over-the-counter medications that you can just buy in the pharmacy or grocery store. On the next slide, I'd like to talk about who should get tested for CKD. In this country, there is no national screening recommendation or recommendation to test all adults over a certain age. But people with medical conditions that increase their risk of CKD should clearly get tested. So people with diabetes, people with high blood pressure, which is also called hypertension, people with certain infections, specifically HIV and hepatitis B or hepatitis C, are at increased risk for kidney disease. Some kinds of cancer, sickle cell trait and sickle cell disease, which are an inherited blood disorder, autoimmune disease, where the immune system attacks healthy cells or tissues or organs, people who have recurrent kidney stones, and people who have recurrent urinary tract infections. In addition to these medical problems, on the next slide, I want to highlight that people with a family history of kidney disease should definitely get tested for kidney disease, regardless of what the cause of that blood family member's kidney disease is. In addition to known genetic diseases, sometimes kidney disease clusters in families. And so having a relative with kidney disease can increase your risk. Kidney disease is also not spread evenly out across this country. And so people who are African American, Latino, Latina, Asian Pacific Islanders, and Native Americans are at increased risk. People who frequently use nonsteroidal anti-inflammatory drugs, which are often called NSAIDs, are at increased risk. And people who have a history of acute kidney injury, a time when their kidney was injured and recovered, remain at risk and should be tested for kidney disease. Next slide, please. I definitely want to spend some time talking about what we can do to protect our kidneys. And a lot of this is true whether or not you have kidney disease, whether you're trying to maintain normal, healthy kidney function, or whether you're trying to protect the kidney function that you have left and delay the progression of kidney disease. And first of all, no smoking. Smoking, everybody knows it's bad for the heart and the lungs, but it's bad for the kidneys also. Smoking impacts every blood vessel in the body. And like we talked about, the kidneys are so dependent on receiving a lot of blood flow. Quitting makes a big difference. If you're smoking now, quitting can go a long way to helping to protect your kidney function. Controlling blood pressure and controlling blood sugar are really important. And I'm actually going to say a little bit more about those. And exercise is super important. Exercise helps regulate blood pressure, helps regulate blood sugar. It's good for every blood vessel in the body, including the ones that go to the kidneys. On the next slide, I do want to focus a little bit on blood pressure and blood sugar because high blood pressure and diabetes are both so important. Having excellent blood pressure control is really important for protecting and preserving kidney function. For a lot of people, this means more than one medication. And for people who have chronic kidney disease, blood pressure is often harder to control, and they often end up needing more than 2 medications. And so my advice would be, don't be frustrated by this. The goal is not to reduce the number of drugs, but to take the drugs that you need to get your blood pressure under good control. If you have a blood pressure medication that you hate because of side effects, there are lots of other choices available, so talk to your doctor. Home monitoring of blood pressure can be really useful in terms of making sure that you are getting to your target blood pressure. And then there are certain medications, especially for people who have protein in their urine, that reduce the protein in the urine and thus both control the blood pressure and have an extra protective effect by reducing the protein in the urine. And these are in the drug classes of ACE inhibitors, angiotensin receptor blockers, and potassium-sparing diuretics. And these are commonly used drugs. I know there are people who are part of Kidney Action Week right now who are taking these drugs. I also want to focus a little bit on blood sugar. And for people with diabetes, there's not one clear blood sugar target that applies to everybody, but knowing what your target is really important so that you can work to achieve it, and possibly with home monitoring and with medication adjustment. Many people with type 2 diabetes need to take more than one medication. And there's a relatively new class of drugs called SGLT2 inhibitors, which help lower blood sugar levels. But they're especially exciting for people with kidney disease or at risk for kidney disease because above and beyond their impact on reducing blood sugar, this class of drugs also is protective to the kidney and the heart. And over the past couple of years, their use has gone up significantly. I think this is a good thing for kidney disease. Next slide, please. And yes, there are more things you can do to keep your kidneys healthy. If you have a cause of kidney disease that, in addition to diabetes or high blood pressure, make sure that if you know what it is and there's treatment for it, you've talked to your doctor and you're getting the optimal treatment for it. Avoiding certain medications like ibuprofen, which is a non-steroidal anti-inflammatory, and these are really commonly used drugs. They're often called Motrin, Aleve, Advil, Naprosyn, all part of the same drug class, which can be hard on the kidneys. For many people with CKD, cholesterol medication is a really important part of both staying healthy and keeping your kidney and your heart healthy. Avoiding herbal preparations and supplements, and avoiding nutritional protein supplements unless there's really a specific reason that you're taking it. But most people are able to get enough protein from their diet alone. I want to talk a little bit about diet on the next slide, because nutrition is so important. What we eat makes a really big difference in terms of kidney health. For a lot of people, decreasing animal protein is a useful thing to do. And in terms of eating patterns and what we should eat to keep our kidneys healthy, I want to highlight the Mediterranean diet, which comes from a region of the world, and also the DASH diet, which comes from an old medical study called Dietary Approaches to Stop Hypertension. And these diets have both been in the popular press, and examples of them are available online. They're food patterns that lean on fruits and vegetables, low-fat dairy products, whole grains, lean meats, fish and poultry, and nuts and beans. The Mediterranean style doesn't specify sodium, but for a lot of people with kidney disease, limiting sodium intake to about 2,000 milligrams or 2 grams a day is a really useful thing to do. And I want to stress the importance of reducing processed foods. And so the dietary patterns that I just outlined focus on foods that are not highly processed. And I read a quote several years ago by the author Michael Pollan that really stuck with me, which is, don't eat anything that your great-grandparents wouldn't recognize as food. And that's clearly simplistic, and our great-grandparents ate a wide variety of different things. But the highly processed and preserved foods that are available so widely and are so popular have a lot of sodium and preservatives and phosphorus. And there's an entire talk on phosphorus later, but I will highlight that we absorb phosphorus when we eat it, and phosphorus is a really common preservative. And when our kidneys are working fine, we eliminate that phosphorus in our urine. And when kidney function is less good, that phosphorus builds up in the body and can be damaging to blood vessels and organs. On the next slide, the other nutrient that I want to highlight is potassium. And potassium is essential for every cell in our body to function, including our muscles and our hearts. The diet patterns that I outlined are rich in potassium, which are useful for people who have good or relatively good kidney disease. But for people with more advanced kidney disease, this is a little trickier because you need to be careful of having too much potassium. Typically, the potassium that we eat, if there's any extra more than our body needs, it's removed by the kidneys. And if you have kidney disease and your kidneys can't remove this extra potassium, it can build up and can be really dangerous. On the next slide, I want to highlight that your own blood test can be an important guide to what you can eat. And potassium and phosphorus are two clear examples of this. These are electrolytes that are commonly checked with blood tests for people who have kidney disease and can give you a clue to whether you're eating too much, too little, or just right of these nutrients. Most insurance, including Medicare, covers nutrition counseling for people with kidney disease. And so I definitely recommend meeting with a registered dietitian who specializes in kidney health, who can help you figure out an eating pattern of things that you love, that are healthy and don't lead to unhealthy levels of potassium or phosphorus in your body. On the next slide, I want to talk about symptoms of kidney disease. And for many people, there really are none. And this is frustrating because being in touch with your body is not enough to let you know whether you have kidney disease or if your kidney disease has gotten worse. Some symptoms are common once kidney function is severely reduced, but there aren't usually symptoms in early stages of kidney disease. In more advanced kidney disease, common symptoms include fatigue and not just a little bit tired one day, but so tired that it's really difficult to get done the things that you need and want to do. Swelling This is most common in the legs, but really can be anywhere. Nausea, and this can also be lumped with either a bad taste in your mouth, or decreased appetite, or at its most extreme, vomiting. And yeah, anybody can get sick and feel nauseous or vomit one day, but this is a pattern where it's how you tend to feel. Difficulty concentrating, which sometimes people describe as mental clouding or dullness. Itching, usually itching that's really severe, like putting on lotion doesn't help. It's not just dry skin. And restless legs. And this is usually worse at night, but can be at any time of the day. On the next slide, I want to talk about progression of kidney disease. And so we've talked about things to do to keep your kidneys healthy. And I fully believe that it is worth putting in the effort to maintain the best kidney function that you possibly can. And sometimes, despite your best efforts and everything you do to take good care of yourself, kidney disease can progress. The most advanced kidney disease is called end-stage kidney disease, and that's a GFR of less than 15, and that's that stage 5 kidney disease. This is typically treated with, and I saw a question in the chat of if your kidney function is less than 15, if your GFR is less than 15, does that mean you need dialysis? No, it doesn't mean that just because your kidney function is less than 15, you need to start dialysis. But that's a range where people tend to start developing symptoms of kidney disease and start to have metabolic or blood test changes from their kidney disease that can potentially be dangerous. So this is a time that you need close medical follow-up to both follow symptoms and make sure that your blood tests are in a healthy range, and think about dialysis when it gets to a place where you need that. So advanced kidney disease is treated with dialysis, and that can be hemodialysis or peritoneal dialysis with kidney transplantation, and also depending on other medical problems with supportive or palliative care, focusing on symptom management, but not prolonging life. On my next slide, I have a couple of key takeaway points. The first is knowledge is power. If you have risk factors, get tested for kidney disease. Don't be afraid to get tested. You can use that knowledge to change what you do and your lifestyle to work on protecting your kidneys. And my second thing is to vote. Unfortunately, my kids are disillusioned with the voting process and think it doesn't matter, but I fully believe that the people that we elect make the policies that shape whether or not we have cities and towns where we can move around, agriculture and food policies that do or don't support healthy eating, and the availability of health insurance, because health insurance and prescription coverage are not a right in this country. Public programs like Medicare and Medicaid and the VA health system are incredibly important to people with chronic illnesses, and they definitely don't cover everybody with chronic illness. So those are my two takeaway points. And I also, I'm going to hand it over to Leanne, who is really going to moderate the questions. I was only able to see a couple as they popped up. But I want to say that I'm really inspired to be here with so many of you who are working hard both to take care of your own health and to take care of other people. And I appreciate the chance to talk with you. And Leanne, I'm happy to answer questions.
Thank you so much, Dr. Perlman, for the very informative session. So I'll just get started with the questions that we have and hope we have a chance to get through all of them. So the first one we have here is if there is damage to kidneys, is it damage to both kidneys or just one?
Yeah, that's a great question. Sometimes people have damage to one kidney, like from trauma or from a change to the artery that goes to that kidney. But most chronic kidney disease impacts each kidney equally. And we think of kidney function as being a combination of what the two kidneys do. And so chronic kidney disease is usually a whole body process that's or a whole kidney process that's impacting both kidneys equally. And that's why if people need a kidney biopsy, it's almost always done in just one kidney, because the same thing that's impacting one kidney will be impacting the other kidney.
Thank you. Can a partial nephrectomy cause CKD?
We all have, well, when things are going well, we have more kidney function than we need. And when we have 100% of our kidney function, we have a lot of wiggle room to lose some of that, which is why healthy people are able to donate an entire kidney to a loved one without a significant change in their own kidney function. Usually a very small decrease, but they don't go on to have serious complications from that despite losing a whole kidney. Similarly, sometimes people need a partial or a whole nephrectomy from cancer or infection. And if the kidneys were working well before that, they're usually able to compensate very well without that kidney tissue. If people were already vulnerable or already had chronic kidney disease, losing part of a functioning kidney can be more of a big deal.
Great segue to our next question that says, what would be the GFR of a normal working kidney?
Yeah, thanks for asking that. I probably didn't say that clearly enough. So a normal GFR it varies a little bit based on how old we are, but a normal GFR would be more than about 90 milliliters per minute per a young healthy patient, or a young healthy individual who maybe isn't even a patient. And so sometimes I collapse that and say, well, 90 is pretty close to 100. And so if your GFR is 15, that's 15 out of 100, or 15% when it's 15 milliliters per minute. So that's not perfect, but it's a common way of thinking about it. So you could say normal is 100 or 100%. And if I have 60, then I have 60%.
Excellent. At what kidney function is a patient required to be on dialysis?
Yeah, there isn't one exact number where everybody needs to start dialysis. So a lot of it depends on how you feel, whether you're having symptoms, and how your blood tests look, whether you're able to eliminate the fluid that you're drinking, whether you're able to eliminate the potassium that you're eating. So we start thinking about dialysis when the GFR is less than 15. On average, people in this country start dialysis when the GFR is closer to about 8, but some people need to start earlier and some people can hold on a little bit longer.
Is kidney damage permanent? Can you move from a stage 2 to a stage 1, for example?
So sometimes people's kidney function improves, and that is always a terrific thing. Chronic kidney disease tends not to get significantly better. And so most of our work and counseling is to keep it steady, not to look for an improvement. But occasionally it improves. And when it does, that's fabulous. And sometimes that's from lifestyle changes that improve blood flow to the kidneys.
So one viewer says his wife went from stage 3 to stage 4 after having COVID. And he wants to know, has it been documented or is it just a coincidence?
Yeah, so I would put that in the coincidence category. But I did say that our creatinine can fluctuate a little bit by time. And since the creatinine is what goes into that GFR formula, and the GFR determines what stage of kidney disease you have, if your creatinine changes a little bit, say by 0.1, that could pop you into a different stage, either higher or lower.
So why don't lab tests report on stage 1 or stage 2 CKD? It seems you only get told of CKD when it's already stage 3.
Yeah, that's another great question. And the formula that is used to calculate GFR really is more accurate when GFR is reduced. And so the formula is much more accurate for telling you whether your GFR is 40 or 50 than whether it's 80 or 90. And so it's very common for labs to report greater than 60 because the sensitivity or the discrimination of the formula that we use isn't very good to tell you whether it's 65 or 75. It's much kind of more accurate to say better than 60, which is a little frustrating for people who want more information. But it's a limitation in not the lab your doctor or provider is using, but in the formula that we all use to calculate GFR.
So again, another GFR question. So if you have some sort of infection, can it cause your eGFR to lower? This viewer says that theirs jumped from 28 to 35 within days, and he wants to know if the fluctuation amount is normal.
Yeah. So the part about an infection, I don't usually think of every urinary tract infection or every cold causing a change in kidney function. But for people who are vulnerable or who are really sick or who get dehydrated and have their blood drawn in that time period, whether they're in the hospital or not, it is common for their creatinine to be up a little bit, which means their GFR is down a little bit. And then as they recover from that and get back to their baseline, hopefully their GFR goes back to their baseline.
So this viewer had large B-cell diffuse lymphoma in 2019 to 2020, and now they have renal sarcoidosis and wants to know, is there any relationship?
Yeah, it's a good question. I can't say 100% that yours is related, but sometimes when people have cancers in their blood cells, and they're treated, and hopefully you are doing well, these years later, but having damage to the kidney because of inflammatory proteins being deposited in the kidney following an event like that is definitely possible.
And this next question refers to an event as well. So this viewer says, my CKD was caused by a golf ball-sized kidney stone that caused an obstruction. I am stage 2. Since I don't have any other risk factors, would that mean my CKD may not progress or progress slower?
So it's when people have CKD that's caused by really an abrupt event, like a humongous kidney stone that completely blocks your ability to urinate in one kidney. Very often that kind of kidney disease is more stable if you're able to kind of completely stabilize the underlying cause. And so one, I'm sure that was really painful and you're doing everything you can not to have another kidney stone, but not having another kidney stone is also important for protecting your kidney function, because anytime there's an obstruction, that can damage the kidney. And by obstruction, I mean when the urine can't leave the body because of a kidney stone. And most kidney stones are so much smaller than that. But clearly you are at risk for having a really big one, and doing everything you can to avoid further kidney stones would be really important. But not having anybody who doesn't have risk factors, anybody who has kidney disease, but doesn't have diabetes, doesn't have high blood pressure, doesn't have another marker of damage like protein or albumin in their urine, they are in a lower risk place, which is great.
So what kind of things can cause kidney damage?
Yeah, so the common things that cause kidney damage, I highlighted, and so I'm curious if that participant has a more specific question, but the most common things that cause kidney damage are diabetes, which is hard on little blood vessels, high blood pressure, or any heart disease or blood vessel disease that can interfere with blood flow to the kidneys, and then infections that can lead to kidney damage, like HIV and liver infections, and autoimmune disease. Those are the common things that damage the kidneys, plus the non-steroidal medications like ibuprofen.
So you listed to include whole grains. I thought the recommendations was to exclude whole grains or it was harder to process.
Yeah. So part of the reason I think it's really important to meet with a dietitian is because some of the recommendations that are super healthy for people who have mild kidney disease become less true for folks who have advanced kidney disease or on dialysis. So whole grains have a lot of benefits, and whole grains have phosphorus. And there's no way we can eliminate all phosphorus from our diet, but a lot of times for people with really advanced kidney disease, they need to limit whole grains to limit the phosphorus that comes with that. Personally, I'm a fan of working with a dietitian and also avoiding processed food because the amount of phosphorus you absorb there is more than you absorb from whole grains.
We have one more question and we'll have to move into closing. Sorry, we couldn't get to all of the questions. Can you improve your GFR through diet?
That's a great question. There's not one thing that you can do to improve your GFR, and there is no like force of will that you can do to improve your GFR. Sometimes when people make really sustained, healthy diet changes, and sometimes this is associated with weight loss, and sometimes it's not, they'll see their kidney function getting a little bit better. But what I really focus on is making changes to help prevent the progression of kidney disease and making changes that'll help you stay healthy for a long time and support your kidney health for a long time, more than hoping that eating one specific thing or avoiding one specific thing will lead to an improvement in your kidney function.
Thank you, Dr. Perlman. Can you share one thing to do and one thing to know based on today's session?
Yes, I would say my thing to know is if you're at risk for kidney disease, get tested for it. There's a lot you can do to maintain kidney health. And so I want people to know that. And my thing to do would be vote. We have an important election coming up this year, and it's one of our opportunities to be heard.
Thank you so much, Dr. Perlman, for all your expertise. And I want to thank our audience and remind them to take the interactive Know Your Kidney tool, a digital resource created to help prevent kidney disease. A member of the AKF staff will drop the link in the chat. Also, to utilize the Know Your Kidney numbers. It is also a digital resource created to help prevent kidney disease by the American Kidney Fund. Up next, we have heart health and kidney disease. Join this session to learn about the connection between heart disease and kidney disease, risk factors, and how to talk to your doctor about CKM syndrome. Once we conclude this session, you will see a brief survey pop up. Please take a minute to fill it out and tell us how we did. Your feedback will be very useful as we plan future sessions. Thank you, everyone, and have a great day.